No medicine can remove the cause of a lifestyle disease, but you can.
This insulin, 100 years back, insulin is we found out and started using it in the medical practice. Another thing which can show the kidney health is the darkening of the face or the cheek and the forehead and all. That is usually happens with those having diabetes, hypertension. Kidney disease usually are two types generally. So the kidney is getting relief from the medicine itself. So any medicine we consider it's a toxin. Common causes metabolic syndrome or metabolic diseases like diabetes, hypertension, obesity, heart disease, or atherosclerosis, which is leading into the kidney failure. And most of the diabetic patients, which is having diabetes for more than 10 years, will be having their kidney function must have usually has gone. Very rarely the kidney function is already affected.
Welcome to this video on kidney disease. We have divided this video into 4 different sections for convenience. In the first section, we deal with the nature and reason for the disease. In the next, we look at the latest developments in medicine and kidney disease treatment. In the third section, we look at the comorbidities, complications, etc. that are usually associated with kidney disease and the role of lifestyle correction in kidney disease management. In the final session, we actually see how clinically supported lifestyle correction helps in managing and overcoming kidney disease. To begin with, the first question is regarding what is kidney disease and what are the different types.
Kidney disease usually are two types. Generally, we can divide the kidney disease into two types. One is acute, that is fast progressing. Within a week, the kidney will fail and there will be symptoms of discomfort and we'll be able to diagnose it early. But in the chronic, it's a chronic disease only after 20 or 30 years only. It will end up with the renal failure. That is the most common actually. In the acute renal failure, usually because of the dehydration with the diarrhea, vomiting or blood loss. That is the most common reason for the acute thing. And also next is the toxins like snake venom, snake bite, or even antibiotics, chemotherapeutic agents, even the contrast dye which is used for this diagnostic procedures like angiogram and some of the CT scan, MRI, etc. This contrast dye is used. So it can also, if the patient, especially the patient is having some undiagnosed kidney problem, it will be manifesting as an acute renal failure in that stage. And another thing for the chronic renal failure, when we come into the chronic renal failure, it is basically the lifestyle disorders like metabolic disorders, basically, like obesity, hypertension, diabetes, which will be chronically damaging the kidney and the disease, and also the medication which is using for the disease will be chronic, affecting the kidney and leading to chronic renal failure. In that, another most important is autoimmune diseases like this SLE and IgA nephropathy. If at all they are diagnosed, SLE usually diagnosed early because it will be very symptomatic. Patient will be having so much of problems, and with the diagnostic test, SLE will be diagnosed and usually look for the kidney function also. But usually the SLE also only after 10 or 15 years, if they are under treatment, only 10 years or 15 years only the kidney failure will come. And in that also the medication which is using for the controlling the symptoms will be contributing a big role in ending up with renal failure. Another thing is congenital problems like polycystic kidney disease. That is all family run also. Here also the important thing we should all understand that the kidney failure, there's no medication. But it all connected with the lifestyle. If you diagnose early, then you can correct your lifestyle, you can prevent a renal failure. Even this congenital polycystic kidney disease also, It can also be, if it is early diagnosed, if you control other lifestyle factors, like you prevent obesity, reverse diabetes, hypertension, all these things can help going in delaying and also even preventing and delaying the renal failure.
Actually, when you talk about kidney disease, what happens is generally it is felt that there aren't any much symptoms initially, so it is like a silent killer and all that. But even then, it will be good to know or check out if any symptoms are present. If you can explain in a few words about what are the common symptoms and also why it is said that diagnostic tests are the only real way of checking out for kidney disease.
In the kidney disease, only at the end stage, the symptoms will appear. That is generally the fifth stage, GFR less than 15. That stage only usually the symptoms appear. That symptoms will be, some patients will come with only with the starting vomiting. Then the creatinine will be 10 or more than 10. Then before that, they are not aware of the problem. Only in that cases, if you check the blood only, you will be able to understand. But we can, this general, a few symptoms we can say is generalized tiredness and also edema, especially the puffy face when you are getting up. And also low in pain, that is low back pain on the sides. Usually central, it is the vertebral pain, but it is the side of the vertebra on either side, right and left is the kidney. And if that part there is pain, then also you should think of the kidney problem. Then any urinary infection or the color changes in the urine. If there is bloody discoloration in the urine, or the darkness of the urine, that can be a sign of the bleeding into the kidney or problem. And also frothy urine. When you pass urine, it is froth formation is too much, then it can be because of the loss of protein in the urine. Especially usually most of the diabetic patients and the hypertensive patient, if it is developing, that means it is a nephropathy. Another thing which can show the kidney health is the darkening of the face or the cheek and the forehead and all. That is usually happens with those having diabetes, hypertension or high cholesterol. That means that is affecting the kidney or the liver. Either of this organ is affected. So that also everyone who's having a darkness developing in the forehead or the cheek or any other part, there will also, and also unnecessary itching and dark patches on the leg or any other part, the skin disease, because skin and kidney is very closely connected, both are respiratory organs. So manifestation, kidney disease can manifest on the skin also. So in that case also, we should look into the kidney function test and find out the finalization or what is, we can more elaborate only with the investigations we can see, or it can come into a diagnosis.
Generally, patients see the kidney as an excretory organ only, basically related to urine. But what we understand is kidney is related to many different systems and organs. Can you highlight what is the importance of the kidney with respect to the circulatory system?
We think that generally people will think that kidney is an excretory organ. But it is not simply an excretory organ. Actually, kidney is controlling our blood volume and blood pressure. So almost all the medicines which is given for the blood pressure control, it is acting really on the kidney. And so the blood pressure control, kidney is having an important role, blood volume control, and hormone management. It is producing many hormones, and it is many hormones produced by the other organs in the kidney. Is also the actual site of action is in the kidney tubules. And another thing is erythropoietin production. Hormone erythropoietin is produced by the kidney. Even the kidney, the filtering volume of the kidney, the kidney is actually around 250 liters of blood is filtered every day. So that much of blood is flowing through the kidney. So we should understand that kidney is not just an excretory organ, it has so many other functions, which is actually hemostasis, that is of the overall control of the excretion and the blood volume. Everything is have a very major role in the for the kidney.
Just like this relationship between the kidney and the circulatory system, regarding this hormonal influence on kidney function and the general endocrine system of the body, it seems to have a very big connection. Because in general, people and patients should know what is the importance of the kidney with respect as an endocrine organ. So what is there to add in that?
Most of the hormones produced by the other endocrine glands and also the kidney produced hormones. Kidney is actually producing mainly three hormones. One is renin. Renin, angiotensin, aldosterone metabolism, aldosterone. That is, angiotensin is produced by the liver, and aldosterone is produced by the adrenals. This is controlling the blood pressure. And also other hormones like one hormone produced by ANP, hormone produced by the heart muscles, and also another hormone produced by the pituitary, ADH. This also finally acting on the kidney actually. That is also has a major role in the BP, blood pressure, and the blood volume control. Next is calcium metabolism. For that, we all know that vitamin D is important for the calcium and the bone strength and everything. And the final most active form of the vitamin D, the calcitriol, is produced by the kidney actually. And another more important thing is erythropoietin. Erythropoietin is controlling the RBC, red blood cell production, in the hemoglobin. The blood's oxygen carrying capacity is decided by the kidney mainly. So this we should understand that many of the hormones is acting on the kidney, and the kidney is producing at least 3 hormones, and there may be other things which we are not yet found out.
Actually, when we are talking about this kidney disease, generally people don't get to the picture of this gut-kidney linkages. But at the same time, it is said that this gut and kidney are very much connected, and any problem with one can affect the other, and vice versa. So what is it that we should know about that?
Gut health and the kidney has very close relationship. The most important is actually our body is the result of the food what we eat, and many food which may not be suitable for our body. For example, this gluten, we are all hearing about the gluten allergy. Gluten is a protein which is commonly found in the wheat, oats, rye, etc. So if that is taken, initially actually celiac disease we have diagnosed, that is an intestinal disease which is debilitating, which is if the patient will develop diarrhea and emaciated and all. Actually the celiac disease and the connection with the this gluten is found out in that first actually. The later we understood that the gluten has so many other side effects like non-celiac other diseases also, even that has psychiatric connection and all. When we are considering the lifestyle, that is the most important actually. The what food which is ideal for the person. It can, if the food is the immune system is reacting to certain food. I have seen patients with which is not tolerating rice. It's in Kerala, the major food is rice, and rice intolerance, wheat intolerance, milk, egg, and even the vegetables like the very harmless vegetable like lady's finger or a lemon. There are people who cannot tolerate such things. So understanding that also is very important to protect the kidney. Next is the intestinal diseases as such. That is the problem. Initially we talked about the food itself, whether it is suitable for the person. Next is gut health. Leaky gut. That is, if there is a abrasion or ulcer or inflammation in the gut, The gut content, we know that the gut content is sometimes so many bacteria and undigested food. This is very unhealthy. We see the feces, the excreta is very unhygienic, and so much of bacteria and viruses and all is there. So it will get a free entry into the bloodstream. So that, and also the toxins entering in the bloodstream will give an impact on the kidney. That is the reason when after a food infection, the kidney can go into failure. And also those patients with the chronic gut disease like ulcerative colitis or Crohn's disease or gastric ulcers, they can get a kidney disease also. In those patients also should look for the renal function and see what is the level of the kidney function, because the kidney will start complaining only in the very late stage. So we should recognize it in the early stage itself.
Actually, nowadays these autoimmune diseases seem to be more rising or are being identified in a larger scale. At the same time, we understand that these autoimmune diseases have a definite impact on the kidney health and kidney disease, and also with respect to toxin clearance and all the associated problems. So what is it that those who have autoimmune diseases should know with respect to their impact on the kidney health?
See, autoimmune diseases which directly impact on the kidney is one is the IgA nephropathy, and another is SLE, systemic lupus erythematosus. The IgA nephropathy usually will not show any symptom at all. It will be getting symptomatic only at the end stage 5 only, usually it will manifest. That is, I had seen patients 35 years or 27 years, they're diagnosed with the renal failure at the end stage only when they're admitted with an omitting. And when the investigation, the creatinine is 10 or 12. So that is one type of autoimmune disease. Another is any autoimmune disease which is affecting the skin, liver, or intestine, which can have an impact on the kidney also. Because these four things are working together for us an excretory organ also. The skin is an excretory organ. It is making waste is expelled through the sweat and even the soil, sebaceous glands. And the liver is actually major excretory organ. If the liver is affected with the disease, autoimmune disease or any other disease, it will increase the workload of the kidney. If the skin is affected with very common skin diseases like psoriasis, eczema, and so many autoimmune diseases which can affect the skin, and it will also make an impact on the kidney. And the intestine, this mucous membrane, that is the internal covering layer, we call it as mucous membrane. The large area is there in the intestine, that if it is affected, that is inflammatory bowel disease and all, it will also affect the kidney. So if any of these diseases are there, we should definitely look into the health of the kidney also, GFR. We should look into that and see what is the kidney health. And another thing is the medications which is used for this autoimmune diseases, like very strong immunosuppressants we are using for that. Even the antimetabolite, that methotrexate, is very commonly used for this psoriasis and rheumatoid arthritis. This all can create problem for the kidney also. And there are other more stronger. I have seen patients who are using 3 or 4 immunosuppressants, which is finally the patient who is diagnosed with SLE and 20 years or 25 years, within 15 or 10 or 15 years, kidney failure will also come. That is because one is the disease progression and the other is the medicine toxicity. Actually, all these diseases comes under the lifestyle disorders, and it is actually because of the toxins entering in our body. Actually, because any medication also is considered as a toxin. Even the heavy metals, we know that pollution is increasing. The air and water and food also polluted. Nowadays, it is hard to find any food without food additives like color, preservatives, coloring agents and all. It's all increasing our toxicity. That is the reason for increasing the autoimmune disease, and definitely it will increase the renal failure also, chronic kidney disease also.
Generally, this chronic kidney disease, when we generally hear about it, it is something like, it is a progressive and irreversible disease. That is the general approach. So in case someone has a beginning of chronic kidney disease, then wait and see, we'll see, because in case something happens, we will go for dialysis, or and that way it is seen. But at the same time, we also hear, no, it is not that, chronic kidney disease is something that is right off, that you have to go towards dialysis or towards renal transplant, kidney transplant. So what is the truth?
See, in the modern medicine, we think only about, we think what can be done with the medicine, what is cure in the medicine. Patient is asking, give me medicine, doctor, I have this. But we should understand one thing. There is no disease can be, especially this lifestyle disease, for the kidney disease, there is no medicine to treat a kidney disease. Only when you are failed, and when it is stage 5, we can think of a dialysis, that is artificial kidney. Actually, this dialysis machine is an artificial kidney. It is taken for 1 or 2 hours a day for filtering, and that also it's only partially. It is not artificial fully. It is only an excretory function. That also it is not doing and in the way the real God-given kidney. So even with the this renal function test, there is a mismatch that usually if it is only in the 3rd stage, but after only the GFR reduced less than 60 only, it will show that is creatinine is higher and abnormal. So that has to change. That is internationally it is done. In many of the renal function tests also, they don't mention about the GFR. That is the earliest we can diagnose kidney disease. And even the doctors who see that also won't comment about it to the patient. Why? Because there is no medicine available. Then why should we tell the patient and make them worry? That is the attitude. That has to change, because in my experience, if it is an early stage of the kidney disease, if you are diagnosing the 1st or 2nd stage, it is very easy to reverse the kidney disease and bring it to the GFR to above 90. It's the normal state by lifestyle correction, not by medication. We should understand that. For that, we had to understand that this lifestyle correction, if it is properly applied, even I had patients who had creatinine has increased to, if it is increased up to 8 and all, it has come down to 4 and all. So it is again, it's advised. There are many patients I had managed that asked for dialysis or renal transplant, but they are maintaining their health without dialysis and this after only dialysis we'll think of the renal transplant. So without going for the dialysis, they are able to manage without that. But depends on the stage. If you are getting the patient in the 3rd stage, we may be able to bring them to grade 2 or grade 1 or normal. But if you are getting it in the grade 3, 4, then maximum to 3 usually. It should not be bring it up to the normal. Then if it is in the grade 5, it is grade 5, it can be a BC, different levels. The early stage, it may be able to bring up to the 4th stage, but in the late stage, we can bring into the clinically normal stage for some time. That's all. So it is, we should understand that kidney disease can be reversible to an extent, and also it can be maintained in that way, reverse in some extent and maintained in that way, provided the patient is willing for the lifestyle correction.
Actually, in the case of what you said now, actually the patient has a big role in trying to understand what is his or her status and then deciding on how to go about the treatment in the future. Generally, we see that when a patient gets a chronic kidney disease, then you advise that the patient should look back in his life or her life and try to figure out what was the primary causes that may have created that situation. So, what is your experience with that?
See, basically the obesity, diabetes, hypertension, heart disease. Heart disease means dyslipidemia. That is, the blood vessels are clogging. Blood vessels are clogging the heart disease, and the heart blood vessels, we take it as heart disease and stroke. And if it is clogging the brain, blood vessels supplying the brain, you will get a stroke. If it is in the heart, you will get a heart attack. If it is in the kidney, blood vessels are clogged, you will get kidney disease, kidney failure. So it is all, these four things are the most common. And next is the autoimmune disease. And there is some familial also, even that polycystic kidney disease, that's a familial disease. But that can also, in all these diseases, even the familial polycystic kidney disease also have a major role for prevention and maintenance, or if it is diagnosed, we can lift the kidney function to some extent, and it can be maintained provided if the patient is willing for the lifestyle correction.
Generally, what are the common diagnostic tests used to confirm kidney disease?
The renal function test, that is a blood test, and also urine test, that can give a basic idea about the kidney disease. And it depends on, again, although the staging is mainly by the GFR, glomerular filtration rate. And next is ultrasound scan. That is also harmless, usually. I'm talking about the least troublesome test. So ultrasound test will give an idea about the kidney status, and also the any abdominal scan we can do. And also there is any stone or anything we can find out. Then if your more test is needed, the CT scan and MRI is there. And also the biopsy. Final diagnosis, especially for this autoimmune diseases, biopsy can also be done. But usually these invasive tests are not usually needed actually. We can, with the modern diagnostic facility, you can, this blood tests and all, we can otherwise also, because kidney is already weak, and then why should we give any injury with the biopsy also. And also this CT scan, and usually give radiation. And always think, if you have a kidney problem, don't use contrast dyes along with this. And you should always, if ask the doctors also whether they are using contrast dye. It can definitely deteriorate your renal function.
What are the most common treatment options in kidney disease?
Kidney disease, if it's an acute renal failure, that is usually kidney disease occurs because of toxin level. If it's an acute exposure of a toxin, we can do dialysis and remove the toxin, and kidney will recover. So it is very, it's almost 99 or even 100%. If usually this acute renal failure patients, you can save the patient with the dialysis. But when it is chronic renal failure, it is actually, this kidney is having around 1 million nephrons, that is the smallest unit of the kidney, and these nephrons will be reduced. So once the nephrons, 1 million nephron each kidney, and even only one kidney is there, then renal function test will be normal. Even the GFR will be above 90 only if the one kidney is properly functioning. So that means if the kidney failure reaches only when there is very few nephrons are there, then only it will go to 5th stage and all. So it is very important that diagnosing it at an early stage. If it is an early stage diagnosed, we will be able to, this not fully damaged, but some nephrons will be only partially damaged. That will be able to recover, make them recover. And that is one thing, when we are talking about the treatment, the patients will always, and the general population always think there is some medicine which can improve the renal function. That is, for the acute renal failure, definitely we have some supportive treatment we can give, and also dialysis will. But the chronic renal failure, we can save the kidney only by finding out the reason for the renal kidney is damaging, and then correcting, reversing the problem. For example, type 2 diabetes, that is one of the most common cause for the renal failure. If the type 2 diabetes, then what will you do? If the renal failure is also, again, we'll immediately give insulin injection. In type 2 diabetes, there's no insulin deficiency. insulin hyperinsulinemia, that is excess insulin in the blood, is actually damaging to kidney. So what we had to do is reverse the lifestyle factors. If it is a diabetes, there will be hyperinsulinemia and excess fat in the body. We had to reverse that and avoid medication. But generally, there are reports. This medical profession, what we usually a nephrologist tend to go ahead and maybe a team of doctors, one diabetologist or cardiologist and a nephrologist, they're working with from the available medicine, which medicine is good. So in that way, there is some directions in general, like these medicines are beneficial, it's okay for the kidney and with hypertension. This medicine is okay for the diabetic with nephropathy. But actually speaking, now no medicine is good for the kidney because it will definitely increase the workload of the kidney. So we should come to, everyone should understand that chronic renal failure, acute may be because of some other reasons which is not in our hand, but chronic renal failure is because of the lifestyle disorders, and it is in the patient's hands, the correction. It is not for the doctors or the hospitals. They can do finally dialysis and renal transplant. That the patient should understand that diagnose early and reverse the basic factors which is affecting.
Actually, you are talking about medications and all. Generally, people who go to a medical setup for managing their kidney disease or for taking treatment for kidney disease, they will be going to that setup basically thinking that they will be getting the right medications in the form of treatment. But from what we understand is that medications, their effectiveness for managing kidney disease is something that is sometimes questionable. So what is the approach that medications have towards treatment of kidney disease?
See, medication, any medicine, it is harmful for the kidney, but we should understand that. But kidney will forgive. If your function is okay, kidney will forgive, tolerate medicines and all. But if you are already on the kidney failure, the kidney, whatever medicines you are using, even the safest for the diabetic patients is considered as the insulin. Insulin itself is harmful for the kidney. And insulin has so many other, and I'm specifically talking about the insulin and the diabetic medication because of the, it is type 2 diabetes. We are actually taking, the patient with the type 1 diabetes needs insulin, but type 2 diabetes already there is excess insulin. Excess insulin is a problem for the kidney, but we are treating with again with insulin injection. That is actually, it is came in our medical practice. This insulin, 100 years back, insulin is, we found out and started using it in the medical practice. That time we were not knowing about what is the action of the insulin and all. And later when we come, the science has improved a lot. But the medical, the people are concentrating on the medicine and the surgeries for the cure. But we are not using the lifestyle factors or the general scientific improvement in the healthcare. Actually, it is not the medicine which can cure you really. It is understanding about your body's functioning and correcting that, making it in an optimal way that can reverse the problems. They reverse the lifestyle disease and reverse the renal function. Renal problem at least to some extent and maintain it in that stage. That is what we can actually do.
Actually, though in kidney disease, surgery, that is with respect to transplant is well known, but at the same time some other disorders also need surgery with respect to the kidney. There is some kidney problems require surgery. Now, what are the conditions in which these kidney patients or kidney disease patients require surgery?
See, kidney patients usually either they will be diabetic or they will be hypertensive or they will be obese. these patients will be undergoing either this diabetes related problem, surgery may be needed, or the heart related, because hypertension they'll be having. Usually most important is actually when they get a chest pain, they will be advised for a angiogram. Angiogram, the contrast dye is needed. And the patient's GFR may be 60 or 65 or something like that. But after an angiogram, it will go dip to the stage 3, 45 or 40. It is usually, I'm seeing such patients regularly. And if after an angiogram, they'll ask for a stent. Sometimes primary angiogram, stent is put together. And after the stent is put, then at least 2 medication is needed, and it is also straining the kidney. With the stent, angiogram and stent application, the kidney function is gone down. And again, because of the stent, to prevent clot formation on the stent, at least 2 medicines will be needed. 2 or 3 medicines usually given. So this will again further deteriorating, may not be, the kidney is very forgiving, so it may not be fast, but it will be gradually deteriorating. So this any surgery, any medication, when the surgery is needed, there will be definitely anesthetic medicines will be needed, and also antibiotic to prevent infection and all will be needed. It will all deteriorate the renal function. So if you are having a renal problem, you should see that you should not have any surgery, especially for the lifestyle disorders, because it can be a reversible thing. But unfortunately, if you get an accident or an infection, then you may need, even infection will come only if you are having, when your immune system is at stake. If your diabetes is reversed and the hypertension is reversed and heart disease is reversed, then the chance of infection also will be very less. So you cannot, if you are kidney patient, you cannot have much of medicine. So you should keep yourself healthy. That is the most important.
Actually, when we are talking about kidney disease treatment, as you mentioned, medications, there is a lot of limitation. Then normally the medications that are associated with chronic kidney disease are for other comorbidities and all that. Then regarding dialysis also, it has its plus and minus and risk and associated discomforts. Then transplant also is something like, once a transplant is done, then it's a lifelong, rest of the life management issue. Even then, why is it that, from what you said, with the lifestyle correction, people can actually manage things better, they can have more control with themselves. In spite of that, why do patients usually prefer to suffer even waiting in the hospital or undergoing procedures and long-term suffering, and they don't somehow understand that their lifestyle corrections can make a big difference?
First thing is the current trend. Everything is according to the trend actually. See, for the last 100 years or the 50 to 100 years, it is actually this modern medicine is replaced even in the other everything. We are definitely looking for the modern medicine. Actually, we are depending on the modern medicine. When I started my medical education and all 40 years back, see, everyone is saying this in Ayurveda in our part of the country. Ayurveda, this modern, Indian medicine system was very prevalent. In Ayurveda, the importance was actually in the food. There are so many pathya, that is, food restriction will be there. So in the modern medicine doctors, so it, even I am, when I was a student, it's all very primitive. It is pathya, that food restriction and all is very, very unscientific sort of thing. And it was the situation in the modern medical, even in the most of the modern medical doctors are seeing it, these things are very irrelevant. But the real scientific evidence are there, the science is so much of improvement. but it is not coming into the medical we cannot say that it is the medicine actually. The modern medical doctors are trained in giving or in any system of medicine. They are trained in using the medicine in the way it is approved and also doing surgeries. In between, this development in the life science is ignored, and thus no one is there to guide the patients according to the lifestyle. And also many of the patients are also not interested. Even the doctors, someone is interested and try to give lifestyle advice, no one is following it. So naturally the doctor's interest will also go. Even someone is interested, it is will not persist for a long time. Because type 2 diabetes patient reduce the weight, otherwise your kidney is already damaged, reduce weight. They will not, because another reason is taking the medicine. The person who is taking anti-diabetic medicines, they will not be able to do the food control, because if they reduce the food, they will get a hypoglycemic attack. So the system is the problem. This the one thing, the modern medicine is about mainly the medicine and surgery, and patients are also looking for the easy solution. Just give me medicine, I will eat it. That is the attitude. Or do whatever surgery you want. I don't want to get pain. Only thing, give proper anesthesia and operate whatever you can do on me. That is the attitude. That has to change. We have to understand that our body is made of food. And the older Ayurvedic tradition of Pathyam is very, very important. And that days, our ancestors may be knowing about detail, but the modern doctors, even the Ayurvedic doctors, may not be knowing the science behind it. But now the modern medicine science is there. Life sciences are incorporate the life sciences, the latest development along with for the lifestyle modification. According to this modern medicine, modern life sciences, and using the diagnostic methods, you can solve all these problems. That is, I am telling from my experience, not from any theoretical knowledge or from the internet or anything. I am talking from my own experience in treating this sort of patients.
Actually, when we think about this kidney disease, as we mentioned earlier, it is very stressful, mentally stressful, financially stressful, and even the caregivers or supporters or family members also find it very distressing and difficult and all that. But in spite of that, we find that as you mentioned earlier, the science is not so much understood, and even the patients also show reluctance. They think that they will be able to get some easy solution from the medical system. With all these sort of complexities, when a patient comes for a lifestyle oriented treatment, what is it that you find in those patients that is different from the general?
See, those patients comes to me, they first understand something about this. They will be, the patients who are coming, usually they search in the web and come to know about my way of treatment. They will be seeing the videos and all. Then one patient actually last day, they're saying that, Doctor, I was watching the video till the end, and only by the end you said about the solution. And then I had gone through other videos and all the searched everything in this. Then I have come over. So that is the usual, because it is the world is so many now in the modern society. There is not much of the one person to another person. That sort of communication is also very less. And also many of the patients, those kidney patients, especially those who are already on treatment, when they come across any other patient who is going for kidney disease or advised dialysis, they will also send. And the The particularity of the patient who's come, they should understand that they want to avoid the dialysis or to protect their kidney. There were patients who, after seeing the videos and informatory videos we are putting also, they understand, many of the people are understanding about the GFR and all the first time. And even they will be looking into their older reports and it is already low, but their doctor is not told anything about them, the kidney problem. Or they go for the GFR test and come that my kidney, the problem is there. There are patients who come and correct it, and the GFR is around 60 and all. You can get it corrected. And if the young age, it will be very easy. But in older age with diabetes and hypertension, they can come out of the medication. That is what we are giving. So, if the patient is willing for a lifestyle correction, for to protect their kidney and avoid dialysis and going for a renal transplant, it is very easy actually if you are diagnosing in the early stage. But if at a late stage also, many of the patients who are even 6, 7, 8 creatinine level and all, that is when in late stage of even the end stage, very late, they can also go comfortably without this. First thing we will be doing is making them come out of the medicine, and the kidney function will gradually improve to some extent. Don't expect it to be fully corrected, especially in the, if it is early stage, it can be fully corrected. At least fully correction also doesn't mean that the kidney is fully normal, but the GFR level can be improved. That is. So basically, everyone should understand that there is a possibility of correcting the lifestyle, correcting this lifestyle disease, especially the chronic renal problems, with the lifestyle correction, and understand that there is no medication and each medicine is actually increasing the workload of the kidney.
For someone who already has chronic kidney disease, what should be their awareness of other complications and comorbidities?
The first thing is, if you are diagnosed with the chronic renal failure or CKD, is how early you are diagnosing it. That is the most important for the prevention of the progress. If you are diagnosed, usually the renal function test is done and the GFR is low or the creatinine is high or there is albumin in the urine, immediately, even though there is no symptoms, you should start preventive measures. The patient may be having you have to look for what is the reason for this renal kidney is affected. The most important thing which is affecting the kidney is, one is diabetes, next is hypertension, third is dyslipidemia, this cholesterol and triglyceride is high, and the fourth is autoimmune disease actually. It's like ASLE or IgA nephropathy, etc. So we have to check what is the reason for it and try to find the progression of the disease also. Not only you cannot save the kidney by treating the kidney, because there is no measures to treat the kidney. Actually, you have to support the kidney by reversing or controlling. Actually, it all comes under the lifestyle diseases. It is always better to reverse the basic problem with the lifestyle modulation.
In a patient who has CKD, what is the role of blood sugar control in managing CKD and the other comorbidities?
See, most common disease which is causing, if you go to a dialysis center, almost 80 to 90% will be diabetic patient. Diabetic patient who will be reaching to the stage of the renal failure, they'll be having very high BP also, and there will be heart disease, cholesterol, and the heart disease also will be there. So this kidney patients with diabetes, actually this is the easiest to reverse actually. If I had seen from my experience, most of the patients we are coming to me also with the renal failure or the diabetic patients, they are unaware of the renal problems actually. Their renal function will be reduced, they will be in the third or fourth or fifth stage. And even those patients who are in the fifth stage also, sometimes they are not unaware of the renal problem, because even the creatinine is 4 or 5 also, sometimes they will not be aware of the renal problem. So what is happening actually, if in the diabetic patients, The diabetic high glucose level is damaging the blood vessels. The kidney, the most important part of the kidney is nephrons, that are the basic unit of the nephron, that is made of very thin, very small blood vessels actually. So these blood vessels are damaged, and also the kidney's function is increased by excess glucose in the blood, and the kidney has to excrete that. And also the medications they are taking, that also actually troubling the kidney, because all these medicines kidney has to excrete. And along with that, there will be other medicines for the hypertension, cholesterol, and the heart disease and all. So the kidney has to be given rest. That is only by controlling your lifestyle diseases with the lifestyle modulation, and go ahead. If you are able to reduce the medication, then there will be definitely the kidney will be function will be improved. And if the patient is in the fourth stage, we will be able to bring it to the third level, and third level to second level. And in diabetic patients especially, what I have seen is, if it is even if they are reached in the third stage, just because of diabetes and hypertension, most probably they may be able to bring up the kidney function much better. Rather than this autoimmune diseases, actually it is very difficult if it is gone down to bring up. But the kidney, this diabetic patient, bringing up the renal function is actually more easier.
Actually, when we are talking about this chronic kidney disease patients, very often, in spite of taking medications for hypertension, they find it very difficult to control blood pressure. Why is it so?
Kidney has a major part in controlling the pressure itself. Actually, the basic reason for this hypertension most probably is the renal origin. What we are using as a medicine for the hypertension, actually all are working on at least partially working on the kidney, because hypertension is this pressure management, the pressure management is the kidney has a major role by secreting renin. Renin is a hormone which is secreted by the kidney, and another hormone, protein from the liver, and another hormone from the adrenal gland. Actually, renin, angiotensin, aldosterone mechanism, and some hormones from the brain and the heart. If they are all combined for the management of the blood pressure. In the kidney patients, when the blood, actually the kidney circulation to the kidney is reduced, that is the reason for this blood pressure increase, and the renal going down of the glomerular filtration rate is the quantity of blood is filtered by the kidney per that is actually this glomerular filtration rate, or the renal function test itself is showing that how much blood the kidney can be able to filter. So when the blood circulation is reduced because of the atherosclerosis, this high cholesterol, high triglyceride, they are actually depositing in the kidney vessels, just like the heart blood vessels we say block. The same thing is happening to the kidney. That is the reason. And when the blood flow to the kidney is reduced, the renin will be secreted and the blood sugar will go high. So almost all these medicines are acting on this renin-angiotensin mechanism, or as trying to block the renin that is secreted by the kidney. So if the kidney is not getting enough blood, whatever medicine you give, the blood pressure may go high. That is in the fifth stage of the kidney disease. It's very difficult to control the blood pressure with the any medicine. I have seen many are taking 3, 4, 5, 6 medicines and all, but it is not, the blood pressure is not controlled.
In kidney patients, how do the parameters of cholesterol and triglyceride impact them?
Yes, cholesterol, actually more than the cholesterol, the triglyceride and the HDL is most important. The HDL is the cholesterol which is taking the peripheral excess fat to the liver for metabolism. And if the HDL is low and the triglyceride is high, then it is a problem for the kidney, because this excess will be deposited in the blood vessels. If the excess is there, why? This adipose tissue is telling that we don't want any cholesterol, we are filled and we cannot take. So there is this triglyceride cannot go anywhere. Actually, cholesterol's function is making it in this dissolvable form in the blood. This oil or the triglyceride is moved into a dissolvable form in the blood and taking it. And cholesterol is taking a part in making this LDL, STL and all. So if the triglyceride is high, the cholesterol is high, your blood vessels is getting deposited with that, it is getting narrowed and blocked. And that is the reason for the renal function failure also. The same as in the heart coronary artery block, for which we are putting the stent. And, but I don't know, now we are not putting stent in the coronary, this renal artery. The reason may be because no one is giving such a diagnosis only for the autoimmune renal artery stenosis. The stenting is advised now, because stenting can create this clot formation on that, and it can impair the kidney function. So unless it is very narrowed and very problematic, especially in this autoimmune renal vessel narrowing, the stenting is used, but not for the usual atherosclerosis.
We often hear that the CKD patients are at higher risk for heart disease. Why is it so?
They are at a higher risk of heart disease because they have hypertension. The kidney patients will be invariably having hypertension, and when the hypertension, the pressure, the tension inside the blood vessels to push the blood to the organs, the heart has to do more work. When the heart has to do more work, the heart muscles will get enlarged. So all the patients with the systemic hypertension, the left heart will be hypertrophic. The left heart, you can see most of the patients also nowadays to know how to read the this echo report and all. In the echocardiography report, that hypertension patients will be invariably having this left ventricular hypertrophy. The hypertrophy means excess muscle is there, so the heart is working more, muscle mass is more, so the heart has to give this coronary arteries. Along with that, the coronary arteries will be narrowed, just like the basic problem is depositing atherosclerosis in the kidney vessels. Just like the coronary arteries will be narrowed, and the heart will be, this heart muscles will not be able to get enough blood and oxygen. So the chance of heart attack will be very high in the kidney patients with the hypertension, and generally the kidney patients, the heart attack rate will be very
high. You had mentioned initially that in autoimmune disease patients, it is more difficult with respect to chronic kidney disease. Actually, patients of autoimmune diseases like IgA nephropathy and lupus or SLE and all, what is it that they should be knowing about it?
See, nowadays, because of the ANA test is anti-nuclear antibody test is positive, it is diagnosed as SLE, systemic lupus erythematosus. That it means it's an autoimmune disease affecting any organ of the body. So now it is early diagnosed actually. I have patients, I am getting more and more patients with ANA positive diagnosed with SLE. I'm taking immunosuppressants and all. And that time the kidney may not be affected. Some patient may be having this albuminuria, but they may not be, the renal function, GFR and the creatinine level will be normal in the initial stage. Actually, we have to find out, the early diagnosis will be focusing on the albumin in the urine and the RBCs in the urine. So RBCs and albumin starting itself, we should understand that it is an autoimmune disease and should not wait for the kidney to fail, showing GFR or some other symptoms. And if you are able to correct this autoimmune process, this autoimmune process is coming because it's also a lifestyle disease. You have to find out the reason for that. What food which you are taking is actually creating problem for your cells, actually nuclear, anti-nuclear. All the cells is having nucleus. So the anti-nuclear antibody is positive and you have to correct it. And IgA nephropathy, what is happening is this IgA, which is excess IgA is produced and that is deposited. It is acting against this nephrons. So they are getting deposited in there and actually acting against the nephrons. These antibodies, IgA antibodies, which is acting against the kidney. So we had to find out what is the reason. So if it is an early stage, we can prevent the progress of the disease if we are able to. That is, I had seen all levels of patients with IgA nephropathy also. In the early stage, it is very easy to revert, and even the ANA test positivity can be brought down to normal. And then this kidney function will actually, this albuminuria will be coming normalized if it is low. It's less than 100 and all. Within 1 or 2 weeks it will be corrected. But those patients, I had seen patients with microalbuminuria more than 1000. It's heavy microalbuminuria. That and depends on the level of the GFR also. That is the kidney function in which grade, first grade, second grade, or third grade. So it is, if it is gone to this 5th stage or the creatinine level has gone raised to 4 and all, it will be very difficult to bring down. But if you find out it early, you can come out of the disease itself. And one example I can tell that one patient, she was very crying and telling that she was diagnosed with, she's only 40, in the 40s. She was diagnosed with this SLE, and she is regularly taking for the 17 years. But that after 17 years, kidney function is gone down. She has asked for this dialysis and renal transplant, and she was saying, "I had done everything, and why I had to reach in this stage." Actually, this patient also, she was on heavy immunosuppressants. Actually, within a month or so, we are able to come out of almost all the medicines for her, except actually she had some this blood clotting abnormality. For that, she was taking a blood thinner, warfarin was taking. All the other medicines she was able to reduce, and when she came, her kidney creatinine was around 6.5 or so. And it was come down to around 4, and even it was reached at a time, it was 3.8 and or something like that. But according to the food and all, it will be going come and out. But she is able to maintain it around 4 actually. And it is almost an year past, she's maintaining it, she's very healthy and no symptoms. And she was taking medication for the arthritis. The arthritis is also very common with the SLE patient, for joint pain, and everything is gone. But the thing is, they had to maintain the lifestyle, and after this just 3 months or 6 months treatment, they had to maintain that order also.
Many CKD patients have a problem that, they have symptoms like itching, skin itching, or their mental ability and all that is slightly compromised. Mental fog is there, and generally they feel fatigued. So how are these symptoms related to chronic kidney disease?
One is this as a part of the disease progression. The toxins, when it is not excreted from the kidney, it will come directly to the skin, because skin is also an excretory organ. So the darkening of the skin, that is actually an early sign of kidney disease. This cheek or forehead darkening and itching on the leg, it's all not very early, but in the stage 3 or 4 kidney patients, these symptoms are very common. 5th stage, most of the patients will be having the skin problems also. Another thing is, if it is when the toxins are coming, the autoimmune process also start. So many patients will be having some sort of eczematous or psoriatic sort of skin lesions, either on the palm or feet or leg, and it is very, very common actually. So if there is a skin problem also, all the patients with kidney disease also, they should look for the kidney problem also, because it's actually our body is not functioning as each organ is dependent and communicating with every cell in the body. That is the hormone and all these interleukins and so many chemicals are there to communicate for them. So If there is a problem in the skin, actually skin is the mirroring all the problems actually, especially the excretory system like liver and kidney. The skin manifestation, we have to take it very seriously and find out the reason for it, and it will be, most of the thing will be autoimmune nature, and we should find out what is the reason for this immune system is misbehaving. Actually, this misbehavior of the immune cells, they are attacking our own cells. But the reason for it is the self-recognition is gone. So they are not able to find out which is self and which is non-self. That is the reason for this autoimmune IgA nephropathy and SLE and all. Our own cells, the immune cells, which is supposed to be protecting us, is not able to understand that this is my own cell. And why they are behaving like that? That we had to find out. That is from the investigations we'll be able to find out that basically it's all depends on our food. The toxins in our food, or it's an intolerant food may be the reason.
Actually, with your clinically supported lifestyle correction program, how do you see patients reducing on their medications?
In the clinically supported lifestyle correction, what we are doing is this we'll be investigate with the test and investigations. This blood test, actually we are mainly depending on the blood test, and for the ultrasound scan of the kidney. For the renal patients, ultrasound scan of the kidney is very important, and we'll be seeing, and not only the kidney, we have to see what is the condition of the liver and the prostate. In men, prostate enlargement is also, most of the patients, it is also actually affecting the kidney if the prostate is enlarged and there is a obstruction to the renal flow. All these matters we are understanding. And with this microalbumin, urine protein, all this we will be, before the starting itself, a basic investigation, not basic, actually it is a very detailed investigation will be done. And then when we are, and also the food, we try to find out what food is ideal for this patient and what this food is, the patient is reacting. So we are seeing that many patients will be very common in our part of the country. The main food is the rice-based food. I see many kidney patients, they are having allergy to rice itself, and the milk is very common, egg is very common, and even the vegetables like simple this lady's finger or the brinjal or even onion, and it's all depend on each patient. It will be differing for each patient. So we had to avoid those things, and also, but we had to ensure that the patient is getting a very good all the nutrition. And the kidney patients, if they are above, if in the third stage also, it is okay. It's actually in the first and second stage patient, the creatinine is this GFR is gone below 60. We had to control the protein also. So that is the difficulty. The protein is needed for the rebuilding of the body, even the kidney rebuilding. But if the GFR is gone below 60, we had to control the protein also. If in the fourth stage and fifth stage, the problem is if this kidney function is gone, usually potassium will not be affected if in the fourth stage also. Potassium is affected if it is in the fifth stage, if the GFR is below 15 or below 20 itself, potassium also has to be restricted. So that is the difficulty. That is why I want no one should go to the third stage itself. Before the third stage, we should be able to find out the renal patients, CKD patients. Then it will be easy, and you can maintain. As well, many of the patients we can go to the normal level itself. At least we can maintain it above 60. Then the patient will not have to restrict the essential food. That is almost 50 grams of protein everyone has to take. And that we will, for the most difficulty is in the clinically supported lifestyle correction for the patient. When the renal failure comes, if it is in the reached in the third stage, you have to cut the protein, you have to cut if the fourth and fifth, you have to put the potassium also. So in the very late stage, if it is going, actually water retention comes in the very late stage. Most of the patients above creatine 8 and all. So then we may have to give some diuretics and all. But it is in all stages we will be able to come out of medication. Even in the fifth stage, that is the creatinine, even in the early fifth stage of the kidney failure, like creatinine is less than 5, we'll be able to come out of all the medicines, including the BP medicine, and if the patient is following everything correctly. And there are patients who are not, will not be fully following also. I have now also an ongoing patient. She's diabetic and she got hypertension, and she is getting this creatinine. She has asked for dialysis, but she has obesity also. But she is able to, her weight reduction is low, and also she is not able to come out of diabetes, and everything is, diabetic control is much good. But she is not able to come down the BP just because she is not able to reduce her weight. Why she is not able to reduce her weight? She is eating other things also, that she is taking carbohydrate, extra carbohydrate, and she is not doing the scheduled exercises. So in such patients, we are actually following the patient by the every week the blood test, especially in the fifth stage. They had to check whether their potassium level, whether it is normal, and whether it is going down. If the patient, that's everything, this clinically supported lifestyle correction, 10 patients, kidney patients, we are giving advices, and one or if they are 10, if their 10 is doing in the proper way, they will get the result. If you are, it depends on how much interest and effort patient is putting.
For someone with the CKD who is watching this program, what is it that they should be careful of into their day-to-day living so that they can improve their health?
The thing is, all the CKD patients, they will be having some of these diseases. Either they are diabetic, almost all will be hypertensive, and some may be having diabetes. And if they are not having diabetes, most probably it will be a autoimmune nephropathy. So what they have to do, actually they will be on so many medicines. So they have to, usually all these patients will be on a nephrology care. So in our standard or traditional, it's not modern medicine practice, this more the current medical practice, the medicines, they're depending always, the doctors will be giving more and more medicines to control the BP and sugar. So that pattern will not work for the kidney, that we have to understand. So I cannot give a simple solution and to tell you that especially those who are on many medication, with the clinical support only they will be able to come out of medication. So they have to find out a physician who is concentrating on that and who is able to control the sugar, whatever the basic mechanism in them, and see that their blood sugar is controlled without medication, BP is getting controlled without medication, and that is what is needed. But the patient has to find out a doctor for that. And in my experience, as I said, within a month, whatever the diseases, if the patient is following it correctly, we will be able to come out of most of the medicines actually. And very rarely, like if the patient has put test and within a year, they may have to go for this blood thinness for an year. And all the other medicines can be come down to normal. And the BP also can be controlled, provided if it's a late fifth stage renal failure, like the creatinine is more than 8, it may not be the ideal 1 to 120, 80 and all, it may not come down. But what I had seen is, if they take 4 or 5 medicine, BP medicine also, there will be, the BP will not be under control. So it is actually, the patient is in the fifth stage renal failure, what we do is, actually even the BP is slightly high also, we start the medicines bring down the medicines. But the patient itself is saying that even if I take this 4 medicine, 3 medicine also, the BP is safe. When you can reduce to 2 medicine also, the BP is safe. Actually, when we reduce to when the medicine is reduced, only the BP started normalizing. And but if they take any stress in the family or any food with high omega-6, or then the BP can go high. So in that occasion, actually, even in the fifth stage, the patient is having a problem, and then the BP is an SOS. That in the medical terms, we say medicine is SOS. BP medicine, actually, BP medicine is not supposed to take in SOS in the standard medical practice. It's every day in the correct time. But after when we stop off all these medicines, if the patient is taking a diabetic patient taking any one day they are supposed to take whatever they like, some carbohydrate also, because always restricting will be the life will not be that enjoyable. So one day weekly they can enjoy food, and that time we take a specific glucose medicine. And if they have a stress and the BP is going high, they can that time alone. And when after that, if the BP is come down, then it is okay. Then they don't have to take. That is the method we are following actually.
What is the difference between self-lifestyle correction and clinically supported lifestyle correction?
In self-lifestyle correction, everyone will be having different ideas or different knowledge level about the ideal lifestyle or what is an optimal lifestyle. So basically, in our school or any curriculum, even in the medical studies, there is not much about the lifestyle correction or about the food and exercise and all. Generally, there will be a say that everyone should do exercise and everyone should have a healthy diet. That is the basic understanding. And then there will be so many things will be circulating in the net currently, in the social media and all. So many, this is good. There will be always a trend also. So everyone will be having different ideas about it. Basically, optimal exercise and optimal nutrition means there is around 57 nutrients needed, including water and oxygen, for the human body. That is the latest understanding about the food or the nutrition, and it has certain proportions also, and that should be in the correct way. And also about the exercise, there is around 650 muscles and 250 joints in our body. All these joints and muscles should be exercised in a systematic way. Then only it is an optimal exercise. And next, third, that is the 2 component. The third component is minimizing the toxins going into the body. So if the 3 things are combined, then that is the optimal exercise. So optimal food will be different for each person. For in the way, when we look into, some may be vegan, some may be vegetarian, some may eat more of a non-veg diet. And there is so many other types of diet, like a kosher diet, halal diet, Jain diet. So different people are depending on different type of food, and also there will be so many food paths and likes and dislikes. But whatever is needed is this 57 nutrient in the correct proportion. And the exercise also we can achieve in different ways. But in many of the exercise, if you are walking or swimming, you will not be getting all the 650 muscles exercised and all. So in clinically supported lifestyle correction, in the way I am advising to the patient or in my treatment protocol, this is the exercise which can be lie down on a bed and do it, so that it is okay for the patients also. Even everyone is patients. Not everyone is patients actually. There are people come for optimizing health or anti-aging or reducing accelerated age and all. But generally, people will be having some sickness, especially arthritis and all. They will not be able to do much of the thing. But it is actually patterned or in a specific way, which can be easily done by the patients who are having arthritis and other health problems like heart patients and everything. And also food also is formatted in that way. But that is the difference. So ideal, optimal food, optimal nutrition, minimizing toxins, that is followed in a systematic way in this. And self-lifestyle correction will be different for each person, actually, that we cannot comment on that. So we'll not be able to understand what is really happening. And also before this clinically supported lifestyle correction, we do a detailed study of the patient's history-wise, patient investigation-wise, and we are giving a clear understanding even about what food is optimal for them by assessing the immune system, how the immune system is reacting to different type of regular food also. So with that, we make a pattern for the individual, each person will be making an individual pattern and then asking them to follow. And also, we'll be following it thoroughly on the online and also because the special chart, and actually it is followed much better than in a hospital admission. It's not admitted in the hospital, but the patient will be followed much better, understanding their lifestyle and everything and activities and everything while they are doing the work or whatever in a home or working atmosphere itself.
Actually, what is the role of lifestyle correction in managing kidney disease?
Kidney disease, especially the chronic kidney disease, the most important, the most common cause is metabolic syndrome or metabolic diseases like diabetes, hypertension, obesity, heart disease, or atherosclerosis, which is leading into the kidney failure, or autoimmune diseases like IgA nephropathy, SLE, or many other autoimmune diseases also can affect. So, or even there are congenital or this polycystic ovarian kidney and different types are there. But whatever is this, most of them have a common reason, that is lifestyle. Even for a patient with polycystic ovarian kidney, we all know that it is familial with genetic deformity. This DNA damage is there genetically. But even that case, it will be beneficial. Why? It is when there are lifestyle factors play with everything. And the expression of the genes also, lifestyle factors is coming. So the epigenetic factors we can modify. Genetics we cannot modify, but epigenetics, actually with the epigenetic factors which is actually driving the way to the disease. So we can modify that with the lifestyle. But there is not much of medicine in all these items. There is no medicine to cure this. So that is but there is, if we are addressing the problem with the correct understanding about how to correct the lifestyle, then we can solve a problem with very great extent.
Actually, when we are talking about kidney patients, normally the largest number seem to be kidney patients who have had a history of diabetes. So, can you share some examples of cases how lifestyle correction impacted kidney patients with the diabetes?
Diabetes is the most common patient generally. And most of the diabetic patients, which is having diabetes for more than 10 years, will be having their kidney function must have usually has gone. Very rarely the kidney function is already affected. So we examine if it's a diabetes patient. First thing is we'll find out whether it is a type 1 diabetes or type 2 diabetes. Many of the patients will be taking already insulin. So we'll do this insulin and the C-peptide level. C-peptide level shows that how much insulin the patient's pancreas is making. The insulin, whether the externally injected insulin, we won't be able to know. Generally, most of these patients will be, this type 2 diabetes patients will be having either a normal C-peptide and insulin level, or it will be high. So if both this will be type 2 diabetes, and we can make sure that if the correct diet is given, we can stop the insulin within 24 to 48 hours, the blood sugar will be normal. So this diabetic patients and any kidney patients, the most important thing is to come out of medications. The optimal nutrition, that is actually a problem. If the GFR is above 60, you don't have to restrict the protein and all. But if it is gone below 60 GFR, we have to you should limit the protein intake. And if the GFR is gone below 30, that is, if it is reached already stage 4, then we have to control the electrolytes, especially potassium also. So that is the difficulty. Actually, in the kidney disease, if the first and second phase of renal failure, it is easy to manage for the patient and the doctor. Not much of restriction is there, and it can be generally, most of patients, it can be come to normal. So that means normal means the GFR can be brought above 90 if it is not below 60. That is in most of the cases. In diabetes patient, I have seen many patients with the GFR below 60. In the third stage also has come up to more than 90. That is the advantage actually. Diabetes patient, kidney function, the chance of recovery is much higher than compared to other cases like IgA nephropathy and all. So in diabetic patient, many patients, it's not all one or two, I have many patients, most of them will be having a low GFR, and the proteinuria will be, albuminuria will be very heavy, even 1000, 2000, that level also. In 1000, 2000 and all, albuminuria, complete reversal may not be possible, or it will take some more time. But it will reduce. The 1000, 2000 and all will come only if there is stage 5 or renal failure. Then it will be very difficult to get out of albuminuria completely and bring the GFR. If it is stage 5, already stage 5, in the late stage 5, with the creatinine 9 and 10, it will be very difficult to bring. But some amount, I recently, ongoing one patient, she has come with around 7, and she had asked for a dialysis. And within a month, her GFR creatinine has come down to 4, 7 to 4 actually, 4 point something. But even though she is still in stage 5 itself, but she's a diabetic patient and obese patient. But her recovery, she's not able to reduce the weight as we are expecting. But even though this is 7 to 4 is a very good thing, but if she come down to 3.5 or something like that, then she will reach in the stage 4 of the renal failure. Then it will be very easy. But because she is young and she is diabetic, I hope that she will be bring down to at least stage 4, and around 3.4 creatine will be maintained. So that is the thing. From where we start, that is the most important, about how much recovery is possible. Most important thing, another important aspect is the patient will be, definitely kidney patients will be on BP medicines and cholesterol medicines, and most of them will be cardiac medicine and all. And almost all the medicines, diabetic medicines, we stop in the first day itself. So all the metformin or all the medications is over itself, kidney is relieved, and insulin also is damaging the kidney actually. So the kidney is getting relief from the medicine itself. So any medicine we consider it's a toxin. Only the nutrition is needed for our body. That is the primary thing everyone should understand. And when the patient is free of medicine, the chance of the kidney workload itself is over, and giving proper nutrition. At least if there is damaged, completely gone nephrons cannot be. That nephron is the basic unit of the kidney. Around 2 lakhs nephrons are there in a healthy kidney. Both in each kidney there is 1 lakh or 1 million, I think. I don't remember exactly, 1 million or 1 lakh. That is the difference. If your partially damaged nephrons also can be repaired, but if the nephrons are too low, it is very difficult. That we should understand. When you start early, that is the most important.
Actually, you had mentioned about this diabetes and the challenges to recover from that, but at the same time, there seems to be quite some hope for many who are having diabetes and kidney disease. What is the situation with respect to those who are suffering from hypertension and who also have kidney disease?
See, hypertension is also the same. basically hypertension alone, if it's an IgA nephropathy, in the late stage it is very difficult. I had seen, see, all the kidney patients will be having, because when the kidneys start failing, that hypertension will naturally come, if whatever is the reason. So basically it is a metabolic disorder, that is diabetes, hypertension, heart disease, dyslipidemia, that is high cholesterol and atherosclerosis, the common, and the patient will be having all this, and they'll be taking all these medicines. That is the most common type of patient. The most important, the beautiful thing in this clinically supported lifestyle correction that is giving me most professional satisfaction is the patient will be out of all the medications within a month. And see, the patient is free of medicine, that they are becoming, it's not only the renal function is improving, they are becoming a non-patient, not a healthy person. So otherwise, they will be continuing with the lifelong medication. So even in any stage, we can bring up the kidney function to the next level at least. And the most important, even in the 5th stage, come with the creatinine 8, 9, 10. And if the patient is clinically stable, if that along with that there is cardiac failure also is there, cardiac failure. I am not saying that there is some cardiac problem, that is ejection fraction. This pumping is reduced, or even I'm seeing patients who are already having troponin level is high. That is already a chronic myocarditis problem is continuing. And with the creatinine and 5th stage of kidney, most of the patients with the 5th stage of kidney can have heart attack problems also, heart problem also, and even their troponin level will be high. In that patient also, we can make them out of the medications first. And then the kidney can at least, most will be coming with the edema and very uncomfortable. The patient taking all these medicines will be very uncomfortable, and the patient's comfort level will be increased. So even the patients with the troponin high and all, they cannot go for a angiogram, angioplasty or bypass or anything. That also kidney patients should understand that if they are especially in the 4th or 5th stage, even on the 3rd stage, never go for, as much as possible, for the lifestyle disease, never go for a surgery or more and more medications. They should try lifestyle correction, and they can come out, they can recover actually, or at least they can prevent the deterioration of the status. If they go for an angiogram or scanning with the contrast dye, the kidney function will be gone. I'm seeing so many patients with this contrast injection, 70 and 72 years, just going for a dyspnea, some chest discomfort, and asking for a angiogram to see whether any block. See, there is no need for checking for an angiogram for a 72 or even say above 50 years. There will be block in the heart. There's no need for anyone to do an angiogram to see how much is the percentage of block and all. But if a patient is a kidney patient also, don't go for such things. It will deteriorate the renal function. And also, if they put a stent, then they have to take this blood thinners for at least for a year. So that itself will deteriorate the renal function. So there is definitely, if the hypertensive patient, they can also come out of the thing is, they can come out of the this hypertension medicine. That is the most important, everyone should understand. But it will be easy if in the 1st or 2nd stage of kidney failure. But as I said, in the diabetes patient also, if it is come down to 3rd stage, below GFR below 60, then it will be little more difficult. And if it is below 30, more difficult, more food restriction, and below 15, it will be very difficult. But there are also many patients without any medication, even the BP can also be controlled, and no medication, then they will be free. But the thing is, they will continue with the food restriction and other restriction, mainly food restriction. It will be a problem.
Actually, in the case of this gastrointestinal disorders, often the patients will do some sort of self-medication and all that. And it is said that kidney patients sometimes actually show symptoms of gastrointestinal disorders, and there's a big connection between this. So how does lifestyle correction impact kidney patients with such symptoms and gastrointestinal disorders?
See, gastrointestinal, this most of the patients will be having gastric problems. That is very common because they are all taking medicine. This medicine is actually creating the problem, gastric problem. See, a heart patients, or even without a heart patient, without any non-heart problem, the diabetic patient will be taking metformin and aspirin, at least metformin and aspirin. That is the simple medication. In everyone, it's almost anyway, more than 50% of the more than 50 years aged will be taking at least a metformin and maybe that it will be more only. I don't think it will be less, and aspirin and a statin also. So if you're taking metformin and these medicines, you'll be having some gastric problem definitely. And if you have already acidity and ulcer or inflammatory bowel disease, the problem is more problematic, and it will be contributing to the renal failure also, renal problems also. So here also the same. When we look switch on to clinically supported lifestyle correction format, especially modulated food and exercise, and many will be overweight also because of the fat accumulated in the stomach itself, inside the tummy itself, will be creating problem. So when these things are usually, if the obese patients, they may reduce 2 to 4 kg in a week itself. So see the difference. In the moderately obese, at least 2 kg. So generally, people will reduce. I have seen patients reducing, especially those patients with diabetes and edema and all. They will reduce almost 4 or 5 kg first week itself after relieving this edema and also the fat. It has to go. Then only you will be comfortable. So the gastric problems will be over, and the diabetic, this other kidney problem also will be relieved. So in the clinic, this when you come to the lifestyle correction, it is not how many disease or how much medicine you are taking. It is not important. Only thing, you are correcting the body and tapering off the medication. How many medications we see? Diabetes first, and BP reducing 4 medicine, 3 medicine, 2 medicine. It's within 1 month most of the medicines will be over. Only thing, if they are taking this pacemaker is already put, or the stent put within a year, then they have to continue with the blood thinners. We cannot stop if an artificial thing is put inside the blood vessels or in the heart. The blood vessel is a stent, it will be covered within a year, so you can come out of that within a year. This patient, usually that is always I tell, if your angiogram, if you're knowing about the clinically supported lifestyle correction, come before the angiogram itself, so your kidney can be protected. And if you're putting after angiogram, asking for a stent before putting the stent, because if you are coming before the putting the stent, you can avoid this blood thinness. And if you are already put the stent, you have to take that. That is also harming the kidney also, especially if in the late stage, like a 4 or 5 stage will be sad.
Actually, when we are talking about kidney disease, there seems to be an increasing number of patients with autoimmune diseases also having kidney disease. So it is considered very complicated, because this autoimmune disease and kidney, when they come together, it is difficult, it is said. How does lifestyle correction impact such patients?
If an IgA nephropathy, if it is diagnosed in an early stage, we can at least one level we can reverse, and any of this. And the most common is what we are seeing here in our part of the country, in Kerala. Basically, one is IgA nephropathy. Next is SLE. These two are the common kidney affected. And some, I have seen one patient who's having this ulcerative colitis, interstitial lung disease, and thyroiditis, and having kidney problem also. but in a moderate level. That is, I think, in the stage 3 and all. In that patient, this this autoimmune disease. And also he had hypertension, and he had put stent and so many problems. But I'm taking so many medicines. I think 18 tablets or around 30 tablets he was taking, including for this ulcerative colitis, immunosuppressants and all. Also for the ulcerative colitis and the other thing, this interstitial lung disease is taking. Everything what is possible can be given in the modern medicine, he has been given. And he was able to come out of all the medications. And I think he's in the 3rd year or something like that. And he's following it up also. He's following everything correctly. And he's come out of all the medicines and all the lifestyle diseases, including the thyroxine, we were able to stop. It is usually the thyroid may take a little more time. Within 3 months or 6 months, he was able to come out of that also. Another thing is SLE. In SLE also, in the early stage, there will not be kidney will not be affected. I remember one patient, she's diagnosed with SLE in very, very young age, in her 20s. And now almost 15 years, she's taking medications regularly, but she came to renal failure, and she was asked for definitely this dialysis and a renal transplant. That is the only choice. No? Then this patient actually, now I think it is more than a year. She was, when she came, her creatinine was around 8 or something, but it was came down to 4.5. Around 4.5 she is able to maintain, and she was obese in the initial phase, and she has come down to around 45. I asked her, she's a short lady, and I asked her to bring down to 40. She's trying for that, and she's maintained. The most important thing is SLE patient, she was taking so many medicines like HCQ and so many immunosuppressants, etc. for this symptoms for the SLE, that is immunosuppressant. Actually, that medicines created this problem. I think she was taking cyclophosphamide or something like that, which is direct, it can create kidney problems. So many of these immunosuppressants, it will suppress the immune system, but it can damage the lungs. Some of them can lead to interstitial lung disease and the kidney failure and all. So, but if a patient, that is my experience, when there are so many SLE patients are coming in. So if after years, they will, I want the patients to take up this lifestyle correction in the early stage of SLE. So you can come out of the problem fully. As the SLE patients are increasing, what every SLE patient or even any autoimmune disease patient should understand that basically the general line of management is like using immunosuppressants like steroids and other, and many may be managed to 2 or 3 or 4 immunosuppressants, and when it is not functioning, then go for biological. That is the mode of treatment, current modern medical treatment. But if they are willing for the correction of lifestyle, they can just come out of all this medication. And even the ANA test, that is actually the diagnostic test for SLE basically, even the ANA will come down. And the first thing is the patient is taking all these medicines and immunosuppressants for the symptomatic relief. And the symptomatic relief will be within weeks itself. They will find it comfortable, this edema, pain, joint pain, everything will be very fast result. Depends, only thing the patient also should be following everything correctly. Within a week itself, they'll be having a reasonable improvement, and it will gradually improve. And usually here also within a month, most of the medicine can be, especially we are most giving importance for tapering of the medication, because the kidney load will be reduced if the kidney also is affected. But if the kidney, in the early stage of SLE, there will not be kidney problem, but that stage itself, we can reverse the SLE as such.
Actually, this kidney disease may be like a wake-up call. But from what you said, this lifestyle correction approach can actually give that person his life back. Like along with the other disorders and diseases also, he can get improvement. So if you look at that, how is this lifestyle correction? What are the things that you feel are positive for a kidney disease patient?
See, kidney disease patient, when they start the lifestyle correction, when they understand about the lifestyle correction, what stage they are understanding and going for the clinically supported. See, I said, if there is a kidney problem, I don't think they'll be able to manage by themselves. They need clinical support, and it is not, I can't say which doctor is giving which way. I can say only about how I manage. In this, they can, the only thing is which stage. If they are coming early, they can be careful in the future, and they can they lead a full life without a renal failure. But in the late stage, at least they can avoid this dialysis for a great extent. And even they are waiting for, if it's in a very late stage, only renal transplant is possible. At least for that waiting period, they can be comfortable and make them more comfortable in a palliative. So in the stage 5, it is a palliative care. But even in the stage 5 also, in the early stage 5, if the patient is not having much of the other clinically stable, patient is reasonably healthy and all, then it is they can be this will make them very comfortable during the waiting period for the kidney and all. But and in that between also, they will be able to avoid the dialysis. But in the patient is very sick and they are having heart problem or other organ also, kidney is failed, even the heart is almost in the failure state, then we will not be able to this clinical or lifestyle correction will not be able to do much benefit, because the nutrition you cannot give properly. The protein is needed, and potassium may be restricted. Then how can we repair? So that is the most important. The repair, they need the nutrition and the hormones and everything. And when the kidney is failed, the renin is overacting, and so many things will be there, because kidney is an organ with endocrine function and all. So kidney, you cannot give a repair possibility will be much less if in the very late stage of the 5th stage itself. It's in the late stage with the clinical discomfort syndrome.
With this, we come to the conclusion of this 4-part series. The initial part, we were able to get an understanding about the reasons and causes behind kidney disease. In the second part, we saw what are the latest treatments available and how a lifestyle correction makes a big difference in patients with kidney disease. In the third part, we went through the complications that are associated with kidney disease and also the comorbidities and their treatment, like diabetes and hypertension and autoimmune diseases, etc., and their treatments, how those also could adversely impact the kidney disease. And in the fourth and final segment, we were looking at how clinically supported lifestyle correction was able to face kidney disease, not only helping to revert it or overcome it or manage it, but also simultaneously make improvements in the other health parameters also, because most of the kidney patients usually have multiple lifestyle diseases, and taking medicines is often seen as a negative for many kidney damaged patients. So how to get out of medications and return to a more meaningful and better life is what we saw in the last segment. Thank you. The informed patient is key to treatment success.